After penicillin, the next family is cephalosporins. Cephalosporins, and these cephalosporin, like penicillin, they also inhibit cell wall. They are bactericidal, kill the bacteria, inhibit the cell wall synthesis, and they inhibit the cell wall synthesis. So what is the mode of resistance? So resistant, in order to resistance from the bacteria, the cephalosporins, the bacteria emerges a protein known as cephalosporinase. It's a type of beta lactamase. Like in penicillin, the beta lactamase cancel out or disrupt that drug, and in the cephalosporin, in the case of cephalosporin, there is a drug cephalosporinase. There is a enzyme encoded by bacteria by a mutation which degenerate this cephalosporin drug. Also, they have mutated penicillin binding protein transpeptidase. So these are the two mode of resistance for this bacteria. The next thing is side effect. So the most common side effect of all the generations of cephalosporins are hypersensitivity reaction, also autoimmune hemolytic anemia. Then we have the disulfiram like reactions, and also we have vitamin K deficiency, and there is a synergism with the aminoglycoside, like increase in the nephrotoxicity when we use aminoglycoside with cephalosporins. So in the resistant type, generation 1 to generation 4, they are pretty much ineffective with the lame pathogens, and in the lame pathogens are listeria, atypical pathogens like having a listeria which emerges protein penicillin binding peptidase transpeptidase enzyme modification or mutation. And then we have the MRSA species, methicillin resistant Staph aureus. It also mutated transpeptidase. Then we have the enterococci, which also mutated its protein binding penicillin binding protein. So that's why they are resistant to cephalosporin. Also, the atypical pathogens, especially those pathogens which have no cell wall, for example chlamydia and mycoplasma, they are pretty much intrinsically resistant to generation 1 to generation 4 cephalosporins. So now discuss the generation by generation different type of cephalosporins. The first generation is very much active against peak. So in the positive peak, it means that gram-positive bacteria, Klebsiella, E. coli, and Proteus, they are very much treated by first generation cephalosporin. For example, Cefazolin, and another one is Cephaloxime, Lex and Faz. So Cefazolin has a particular another important function, that it is given prior to surgery in order to cope Staph aureus wound infections. So it pretty much commonly given to the patient which are pre-op prepared. So we give Cefazolin. The next one is Cephlos, the second generation, and in the second generation they are again the mnemonic is very much second generation medication are the second graders which wears the fake fox like fur on tea party. So second generation cephalosporins, their name are very much important. In the Cephate type, we have the Cefaclor, Cefaclor. Then we have the fox, Cefoxime, Cefoxime. Then we have the Cefoxitin, Cefoxime, and Cefuroxime, Cefoxitin, and then Cefuroxime and Ceftaroline. So their name are pretty much important because the second generation cephalosporins are pretty much effective against gram positive hens and the peaks. Peak being Klebsiella, E. coli, Proteus, in Haemophilus influenza, Enterobacter, Neisseria, Serratia. So these mnemonics are pretty much important in order to know which cephalosporin is used and which is not. Like which cephalosporin is used in order to kill the peak bacteria. So we have first and second generation. Which organism is used against Haemophilus influenza, Enterobacter, Neisseria, and Serratia? Second generation. Which drug is used prior to surgery? Cefazolin. Then we have the third generation, and in the third generation, they crosses blood-brain barrier. So we give them to very serious gram-negative infections, especially those which causes meningitis, all kind of meningitis, including the listeria. So all kind of meningitis. Then we have the all kind of gonorrhea. So there is an algorithm regarding the gonorrhea. We give empirically we give Ceftriaxone and doxycycline, whatsoever the status of either chlamydia positive or negative. So when we start empiric therapy with Ceftriaxone and doxycycline, but when the result of chlamydia agar clinic when the result for the detection of chlamydia is negative, then we continue with Ceftriaxone, but when it is positive, we switch to doxycycline. So this is a general algorithm in order to cope up with that gonorrhea. Then we have the Lyme disease, Borrelia type of infection. We give third generation cephalosporin, especially the Ceftriaxone. We have also the Ceftazidine, Ceftazidine for Pseudomonas aeruginosa. So this is for the gram negative Pseudomonas aeruginosa. Then we have the fourth generation, which is Cefepime, and this fourth generation is pretty much effective against the Pseudomonas and also gram negative and positive. And the fifth generation, last one, is Ceftaroline, and it is very much effective against MRSA and Enterococcus cocci fecalis, along with gram negative and gram positive. So these are the general important high yield points regarding the cephalosporins. So how question appear in the actual board exam? Like we have the lame bacteria, listeria, atypical chlamydia, and mycoplasma, MRSA, and enterococcus. So which in the cephalosporin class, which antibiotic is very much effective? So the answer is fourth or fifth generation, Ceftaroline or Cefepime. And which is given prior to surgery, we give Cefazolin. Which is effective against peak, we give first and second generation. Which cephalosporin is very much effective against pseudomonas. So we have the two, third and fourth generation. And so this is which generation of cephalosporin is crossed the blood-brain barrier. It's a third generation ceftriaxone. So this is the whole synergism with glycoside. Then we have disulfiram-like infection. How this the mechanism of resistance for cephalosporin. So these are all different aspects how examiner tests the examinee for this cephalosporin type of domain. So this is how examiner asks question from the examinee.